The World Health Organization says Africa needs another 20 million doses of the AstraZeneca vaccine over the next 6 weeks just to finish vaccinating the small number of people who have started getting their shots. How does Africa get the shots it needs? And what has the pandemic shown us about Africa's responses? Hello, thanks for joining us. This is Our Voices, and I'm Dimyake Mwakalielye. Now, since the start of the COVID-19 pandemic in 2020, VOA Africa Division has hosted various virtual town halls featuring medical experts to explain more about the coronavirus. Today, we bring you part one of a special edition of Our Voices based on those town halls, where women who are leading Africa's fight against COVID-19 answer viewer questions. In Somalia, Dr. Faduma Abdi explained how the virus affects young people and old people.
When COVID-19 first reported globally, it was noticed that the elderly were more likely to get seriously ill. They were the deadliest group. Therefore, age is important. With the new variants of COVID, however, there has been an increase in the number of young people becoming infected and dying from COVID-19. In addition, there is the so-called long COVID. The long COVID is a range of diseases, such as muscle aches, that can last for a long period of time after people are infected with the coronavirus, and it is more common in adolescents.
marka xanuunka qoro iyo dhakhtarka la jiifinayo maaha kadib waxa la socdo dadka qaar ay ku badan yihiin dadka dhalinyaradana waxa la socdo xanuun kale long covid way jiraan dad imaka dalkan Ingiriiska joogo sanad waxa hay xanuunkaasi ay leen alaankan wali ma shaqo tagin
I have heart disease. If I were infected with coronavirus, what would be the risk?
corona maxaa dhibaato ku yeelan kara hadii uu igu dhaco
Good question. If a person has chronic illness, such as heart disease, kidney disease, and other serious diseases, he or she is expected to develop a severe condition of COVID-19. Therefore, we advise those types of people with pre-existing conditions to be extra cautious and always wear a face mask, wash hands, and stay home most of the time. In Britain, people with pre-existing health conditions are ordered to stay home. They became the first people to be vaccinated against COVID-19. My advice is that if you have a severe illness or condition, you should get the vaccine if it is available in your country you live in. If not, be cautious, stay home.
Is the vaccine halal or haram?
waxaan joogaa magaalada Sheffield waxaan rabaa in laga soo warbixiyo daawadan inay xalaal tahay inay xaraan tahay bas kaliya.
That question was debated, and the vaccine was determined to be halal. Even the world's leading scholars were asked, and they said that the vaccine is halal. When other Muslims acknowledge the legitimacy of the COVID vaccine, what differentiates us from other Muslims? Muslims around the world have been advised that the vaccine is halal. Therefore, just as the rest of the Muslims around the world, we should accept that. In addition, we take the vaccine for various reasons, like protecting yourself, your family, your community, the society in general. It does not protect you alone from the disease. It protects the entire society, including the weak and elderly.
Protection by marka ma adoo qora waa society oo dhan ayanu silaalanayna.
I am very much baffled about what COVID-19 is. Can you explain to me what it is and how it is transmitted?
xanuunka la leeyahay coronavirus ee magaciisa lagu soo gaabiyay COVID-19 waxa uu yahay iyo waxa uu meeshu ka yimid
iyo dadka soo ugu dhaco iyo soo dadka u haleela iyo wuxuu yahay sidiisba bahalba ma wax duulay oo dabeelaha raacay qashin ba inaan dadka weydi aad baan ugu wareeray aniga ma aqaan Faduma wuxuu yahay
coronavirus waa virus
Coronavirus is a virus. Influenza is a virus. Measles is a virus. There are many viral infections. This family of virus has already been seen. However, this specific type is new to us, and it became a pandemic after it spread all over the world. It is a contagious virus, but preventable too. There are things we can do to prevent contracting the virus. Wearing a mask when you are out, regularly washing hands, and social distancing are essential to protect against COVID. If you notice specific symptoms, you must quarantine. If we do this, we can prevent this disease.
waxaana ku xiga vaccine talaalkan ayaana dagaalka nugula jirta.
Dr. BERTHA SERWA, an infectious disease specialist, assistant professor of medicine at the Cancer Health Sciences Center, and a member of Africa's CDC's African Task Force on COVID management, answered questions about people getting sick from the vaccine.
The COVID-19 vaccine is designed to prevent severe illness from somebody who would contract or at least be exposed to COVID-19. So I don't think that the vaccine in itself would give you other diseases. And so I want to encourage people that vaccines are useful, they're safe. Wild-type polio has been eradicated using the polio vaccine. And this, even though the vaccines, COVID-19 seems to have been developed in a short amount of time, the only reason why it was done is that there was funding available. And because we're in the middle of a pandemic, it was easy to quickly prove or show that the vaccines are safe. At this point, we don't have much evidence of long-term effects. I have been vaccinated back in January. I'm not experiencing any long-term effects. And people who have received the vaccines are going to be followed very closely. And so I think overall, these are safe vaccines that people are encouraged. And I would strongly recommend that people go ahead and get the vaccines.
Rukayya Wamakko is director of Nigeria's National Primary Healthcare Board. She joined a VOA town hall in Hausa.
My name is Hawa Yurima from Borno State in Nigeria. Doctor, my question for you is, what are the negative effects of coronavirus vaccines on pregnant women?
I am very excited by this question from Hawa Yarima. The fact of the matter is, in vaccines development global records, the COVID-19 vaccines were among the quickest and then fastest to be developed within a short time and then received approval for mass usage. The vaccines were speedily developed, and their clinical trials were also speedily done with a lot of money and other resources went into it, all in a very short time. Research is still ongoing.
To a cikin haka har yau ana bincike mata masu ciki da mata masu shayarwa da yara ƙanana yaya za a yi da su akan wannan abin nan da ana bincike akai. Don haka a halin yanzu dai a wannan mataki na farko mata masu ciki da mata masu shayarwa da yara ƙanana ba sa ciki a yanzu.
We have to take a short break. Are you planning to get vaccinated or have you already got the shot? Share with us on our social media platforms, Facebook, Instagram, and Twitter. Our handle is @VOA Our Voices. You can also send us a message on our WhatsApp. The number is on your screen. When we come back, you'll hear from experts about vaccines and pregnancy. Don't go away.
I would recommend being vaccinated to everybody close to me and my family members because the government brought the vaccine in for the good of the people. People must know that instead of hesitating, they must go and get vaccinated.
Now that I'm being vaccinated, I feel safe socializing. Because I think it's very important for people to get vaccinated so that we could actually go back to our lives, back to normal.
Yeah, it's very important because, the vaccine prevents you from getting the virus, People have the misconception that coronavirus is not real, but it's very real. I work in the hospital, so I know what I'm talking about. So I would entreat everyone to vaccinate.
Herd immunity is something we need in order to carry on with life as usual.
So it's not like maybe the whites are coming to kill us, or they will give us the poison and all. That's what people are thinking. But most of the drugs are coming from outside the country. So it's not like it's a worldwide. Something that is coming out. So but people are afraid that they will die and all that, but it's not so.
Welcome back. You're with Our Voices. Today, we bring you views from women experts at the forefront of Africa's fight against coronavirus. Women commonly ask if pregnant women can get vaccinated. Some countries like Mozambique have held off on that. The director of Mozambique's expanded immunization program, Dr. Graça Matsinhe, explains why.
Studies that have been done so far on the effectiveness of these vaccines have not covered children and pregnant women. So there's currently no safety data that would allow us to move towards vaccinating children or pregnant women, which does not mean that there is an absolute counterindication showing we should not vaccinate, but it is a matter of precaution. If we, for example, talk about pregnant women, we know that pregnancy is a very delicate period, and everything we want as healthcare professionals to prevent any harm from being caused to the mother, but also to the fetus. So for the sake of precaution, vaccines are not currently being administered either to children but also to pregnant women because there is no safety data for administration in these groups. However, there are many studies that are still going on. There are studies that involve the phase including pregnant women. Mozambique will be one of the sites for one of these studies involving pregnant women. And when we have enough data to allow us to make a decision to vaccinate these specific groups, naturally, they may be included in the vaccination process, taking into account the specifics of each vaccine available.
Estes grupos específicos naturalmente poderão ser abrangidos no processo de vacinação, tendo em conta a especificidade de cada vacina que estiver disponível.
Dr. Abdi says pregnant women can get vaccinated, but advises those with pre-existing conditions to consult with their doctors first.
Yes, pregnant women can get the vaccine. At the time of this vaccine's clinical trial, no pregnant women participated in the trial, but some of the female participants became pregnant during the test and nothing happened to them. It is not believed that the vaccine will harm the fetus. However, it is highly advised that women with pre-existing conditions such as heart disease, kidney disease, cancer, and diabetes discuss with their physicians about their options and whether they should get vaccinated.
the risk baa jira ama haday ku jiraan shaqooyin ay umada ay ku dhex jiraan marka waxa jira imanaya halis kale marka inay dhakhaatiirtooda la hadlaan ay yiraahdaan maxaa ii fiican inaan qaato inaan iska daayo laakiin horta laguma oga talaalka.
Cross-border travel has been a challenge when it comes to testing, and Dr. Matsinhe says Mozambique worked closely with South Africa to implement mandatory testing.
Because our economy depends a lot on South Africa, there is a lot of movement between the two countries. And when the numbers of cases started to increase exponentially, it had, of course, to do with the massive influx of people residing or working in South Africa or who came to Mozambique for one reason or another. This movement of many people, and in a situation in which South Africa already had a high number of infections, naturally led to this increase in cases in Mozambique, precisely because of this issue of mobility. Therefore, the issue of cross-border relations has had a very big impact for our country. There was also a need to limit this movement of people in order to try to contain the infection and prevent a very high number of people from becoming infected.
Das relações transfronteiriças tem impacto muito grande a nível do nosso país e, bem, como uma das medidas também houve necessidade de se limitar esta movimentação das pessoas no sentido de procurar conter a infecção e evitar que haja número muito elevado de pessoas que fiquem infectadas a nível do país.
In our French coronavirus town hall, Dr. Marie Mbanga took a question from Samantha Pascal in Kinshasa in the DRC about the different kinds of vaccines.
Is the COVID-19 vaccine effective? And if it is effective, should we really trust this vaccine? Because several countries have suspended vaccination against COVID-19 with the AstraZeneca vaccine.
I will answer Samantha that the health crisis today is not only a health crisis, but also a political crisis. However, we must trust science. Science is the one that made discoveries that allowed us to eradicate diseases, such as polio, which are infectious diseases like COVID. So science remains relevant, and it is imperative that political decisions be based on science. What does science say about vaccines? The studies done to put the vaccines on the market have been meticulous and are approved by relevant bodies and authorities.
Marché comme celui, par exemple, qui est aux États-Unis, ont été minutieusement approuvés par les organes.
They have the efficiency and sensitivity necessary to provide immunity at this stage of the disease. On the AstraZeneca vaccine, I want to remind you that the rate of venous thrombosis of people who have been vaccinated may not be significantly lower than the rate of the thrombosis of the general population, so that the people who died who took the vaccine died. So the population must be very careful, and it is also a call to politicians who must make decisions based on science and be careful not to alienate science and popular beliefs. Vaccines for now are the most effective solution we have today against COVID-19.
Pour l'instant, sont la solution la plus efficace que nous avons aujourd'hui pour le COVID-19 et ce n'est sûrement pas à prendre à la légère.
Dr. Matsinhe says the vaccine issue is a complex one.
It is true that there is already a considerable number of vaccines approved and also a much larger number of vaccines that are still under study. Others still await approval, which makes us believe that in the near future, we may have more options. The issue of vaccines availability is a very big challenge, especially for low and middle-income countries that are fundamentally dependent on international support to ensure that they have vaccines in their countries.
Embora haja muito esforço a nível global no sentido de assegurar que cada vez mais vacinas sejam disponíveis, infelizmente não é.
This ends up being a challenge because, on the other hand, there is all this need to contain the pandemic. Although many measures are already being implemented, we believe that the use of a vaccine on a larger scale can effectively constitute a turning point in order to contain the spread of the virus. It is true that of the vaccines that are available, most of them have a greater benefit in relation to severe cases and mortality. We believe that with the vaccine available, severe cases and mortality will be reduced, but also the mortality itself can be reduced if we ensure that at least 60% of the population is vaccinated.
O ponto de viragem no sentido de conter a propagação do vírus. É verdade que das vacinas que estão disponíveis, a maior parte delas tem um benefício maior em relação aos casos graves e mortalidade, mas ainda assim nós acreditamos que tendo a vacina disponível, quer seja os casos graves de mortalidade poderão reduzir, mas também a própria mobilidade pode reduzir, se nós assegurarmos que pelo menos 60% da população.
Vaccinating urban and rural populations holds different challenges. Dr. Matsinhe explains the situation in Mozambique.
If we look at the issue of availability of cold storage, for example, I would say that we do not have big differences because over the years, there has been work to prepare our cold storage chain at the national level to receive a high volume of vaccines. But of course, there are other types of challenges. The access challenge becomes very important, especially when we talk about some provinces in the north region where we have a lot of rain. This naturally affects the delivery of vaccines to healthcare units and even impacts availability of healthcare workers. We're talking about the difficulties in reaching many places. So in these places, it's a challenge to be able to ensure that healthcare professionals are vaccinated. Let's say that as a strategy, a way to minimize these access challenges, there must be a mobile units that can reach places where there are access difficulties and where professionals cannot move to the nearest point to be able to receive the vaccine.
Como uma forma estratégica, uma forma de minimizar esta situação do desafio de acesso, tivemos que instituir brigadas móveis para poderem chegar aos sítios onde há dificuldades de acesso e onde os profissionais por si só não podem deslocar-se para o ponto mais próximo para poder receber a vacina.
We're going to take another short break. When we come back, how much longer before we ditch the masks? And are African governments neglecting other killer diseases such as malaria because of coronavirus? Stick around to find out.
We're bringing women's voices to the conversation, and more than that, we're building a community of inclusion and empowerment.
Here in Kinshasa, campaigns to raise awareness against the spread of coronavirus are common, but getting that information to people who have no access to water, electricity, or money can be a challenge.
We are here at Kalerwe Market in Uganda, Kampala, where in this whole market, women are crying out for their situations to change.
For women, it will be better for us.
I think a big thing for me is just being able to say that when these protests are happening, does it turn around into policy?
Our kids are raped every single day.
This movement got the governments to listen. It really was powerful because it showed what is possible when men and women band together and say, enough is enough.
It's not necessary anymore to climb on a car. I can be in any place to cheer with the people.
Welcome back. You're watching Our Voices on the Voice of America. Now, since COVID-19 was declared a pandemic last year, everyone was advised to wear masks. But for how much longer? Togolese student Charbel Kofi posed this question to parasitologist Dorothée Kinde-Gazard and our French colleague Jacques Aristide.
When are we going to stop wearing the mask?
Rather, I would say, when are we going to stop talking about the COVID crisis? As long as the disease is there, as long as we do not reduce the disease, we must wear the mask because today prevention is the best weapon. We have the vaccines, and the vaccines will protect us against the occurrence of severe forms. The vaccine didn't keep me from getting sick. However, wearing a mask reduces contamination, reduces transmission from one sick individual to another. So barrier actions must continue, even if we vaccinate ourselves, until we control this disease.
Réduire la transmission d'un individu malade vers un individu sain. Donc, les gestes barrières doivent continuer, même si nous nous vaccinons, et les prédécesseurs l'ont déjà dit, il faut continuer les gestes barrières jusqu'à ce qu'on contrôle cette maladie.
Dr. Wamakko answered a question in Hausa about how worldwide attention to coronavirus has impacted other more prevalent diseases.
Why are African governments not fighting other diseases that are killing more people on the continent, such as malaria, with the same vigor as coronavirus?
Of course, it's a non-deniable fact that malaria is causing serious havoc in developing countries, in Africa and elsewhere, including Nigeria, Niger, and others. We know the disease is caused by mosquitoes, and there are a lot of cures for it. That is not the same for diseases such as polio and COVID-19. The only major intervention for them is vaccination. And as I said, producing their vaccines is more expensive than malaria cures. As a result of this, government stepped in and took up the responsibility of providing these vaccines to its people free, for them to get protection from the deadly virus. There is a popular saying that prevention is better than a cure. Before you get infected with the virus, you can protect yourself through the vaccines, which is very expensive. And the government is aware that people cannot afford it, but they can afford malaria treatments. Malaria cures are ubiquitous. They are everywhere. That's not the case for vaccines. From its production to storage to transportation, management, and cooling facilities to preserve its efficacy. All of these are very expensive. There must be constant electricity supply for it to be stored in the right temperature. Individuals cannot afford all these, but the government can. That's the reason the government is pursuing vigorous vaccination campaigns to protect people.
Ba maganin shi kuma ba za a iya sayan maganin ba in an yi rigakafin shi to ta ɗauki nauyin ta saye shi komi tsadan shi ta ba wa al'ummanta kuma a bi su a yi musu yekuwa a yi musu faɗakarwa su zo su karɓi wannan maganin saboda me wannan rigakafin saboda me saboda su samu kariya.
And that's where we end our show this week. But join us again next week for part 2 of this special edition when experts respond to more audience questions about the coronavirus. I'm Dimyake Mwakalielye. My thanks to the Africa Division Language Services that brought us these voices from virtual town halls. On behalf of everyone here on Our Voices and at the Voice of America, thank you for watching. Stay safe.